Hello everybody and welcome back. Today we're going to be talking about the measurements of the cardiac flows. The flow of blood in the outflow tract, which is the aorta or pulmonary valves, can be measured using standard echocardiography and the Doppler ultrasound technique. So it can be measured by two ways, the Doppler ultrasound and the standard echocardiography. The peak velocity and the rate at which the pressure rises are much higher in the left ventricle than in the right ventricle. The pressure volume loop. The pressure volume loop is the phase plot of the cardiac cycle. It describes the relationship between the ventricular pressure and the ventricular volume. It is also useful for the evaluation of the pumping activity of the heart. Now we're going to be talking about the work of the heart. The work of the heart, which produces the stroke work output, is the amount of the energy that the heart converts to work during each heartbeat while pumping blood into the arteries. The general expression of the external work is done by a mass when a mass is lifted by a certain distance, which is work is equal to force multiplied by the distance. For pressure moving a volume, the external work is equal to pressure multiplied by delta V, which is volume. The pressure volume area. The pressure volume area is used for calculating the net external work. It is also an index of myocardial oxygen uptake. It also requires invasive monitoring for acute determination. In clinics, the pressure work can be approximated by the product of stroke volume and peak systolic blood pressure, which is measured by systolic blood pressure multiplied by the stroke volume. Minute work output is the total amount of energy converted to work in 1 minute. It is equal to 1 minute work is equal to systolic blood pressure multiplied by stroke volume multiplied by the heart rate. The total external work is the sum of the pressure volume work, which is equal to the area of the PV loop, which is the pressure volume loop, and the kinetic energy. It is equal to work is equal to pressure multiplied by delta volume plus half mv squared. Kinetic energy. Kinetic energy is half mv squared, where m is the mass of blood ejected and v is the velocity of ejection, which represents the energy spent for the acceleration impaired by the heart to blood during the cardiac cycle. It accounts for less than 1% of the total external work in a healthy heart, but increases steeply in aortic stenosis. Now we're going to be talking about the tension heat. The tension heat is the potential energy generated by each contraction that is not converted to external work, but it maintains active tension, which is the energy cost for isometric contraction. The muscle breaks down ATP and the energy ends up as heat. So muscle breaking down ATP, which produces heat. This is the heat produced, which is called the tension heat. The pressure against which the ventricle must pump is a major determinant of the tension heat. The pressure, which is inside the aorta and pulmonary. Now the formula. The formula is K multiplied by T multiplied by delta T, where the delta T is the time interval that the ventricle maintains this tension, and the T is the tension of the ventricular volume, and the K is the proportionality constant. The total energy required for the cardiac contraction. The total energy transformed in one cardiac cycle is the sum of the total external work done on the blood and tension heat. The equation is E is equal to P multiplied by delta V plus half mv squared plus K times T times delta T, where E is derived mainly from oxidative metabolism of fatty acids, lactate or glucose, which is the rate of oxygen consumption by the heart, which is a measure of E. The tension heat is the major determinant of the total energy requirements of the heart, which is of practical interest for the patient with coronary heart disease. Now we're going to have a practical application. A patient with coronary artery disease during increased physical activity needs to improve the cardiac output. The cardiac output, which is the heart rate multiplied by the stroke volume, which is the lowest energy consumption. The major burden is not the work, but tension heat. The target is to lower the tension by lowering the blood pressure. To shorten the delta T, you need to lower the heart rate in order to spend less time in systole. Cardiac output should be increased by augmenting the stroke volume while a low blood pressure is kept. Now we're going to be talking about the mechanical efficiency of the heart. The mechanical efficiency of the heart, or the efficiency of work, is the ratio between the external work performed and the total energy expenditure during systole. It can be defined also as the relation between the work performed and the myocardial oxygen uptake. The maximum efficiency of the normal heart is between 20 and 25%. In heart failure, this can decrease to low as 5 to 10%. Now we're going to be talking about the cardiac performance. The cardiac performance is a generic term referring to how efficiently the ventricles are carrying out their function as a pump. The cardiac performance is equal to the actual cardiac output divided by the optimal cardiac output. So this was everything for today. Thank you very much and hope to see you soon again in the next video.